Hi, I'm Eli Briggs. I'm the Government Affairs Director of NACCHO, the National Association of County and City Health Officials. And I'm here with Winnie Holland, who is going to help me today with a role play of a meeting between a NACCHO member and a member of the congressional staff on Capitol Hill. And Winnie, do you want to introduce yourself?
My name is Winnie Holland. I'm a local health official from Florida, and I'm glad to be here today.
Great. So, hi there. Thanks for coming in.
Hi, my name is Winnie Holland. I'm a local health official from Florida. I appreciate you taking the time to talk with me today.
Sure.
I'm in Washington for a meeting with the National Association of County and City Health Officials, and I just wanted to take a few minutes to talk to you about local public health and how important it is that we continue to receive federal dollars and federal support for the activities that we're doing at the local level.
Great. No, thank you for coming in. So what are some of the challenges that you're facing in your community that federal funding is helping with?
Well, the Public Health and Prevention Fund will really help us be able to provide some funding for chronic disease prevention. In my county, I'm one of the top 5 counties in Florida with high rates of obesity. We have high rates of cardiovascular disease and diabetes, and chronic disease prevention really is a means by which we can have a positive impact on those rates within our county, and those dollars would really help us in that regard.
What specifically does your health department do to address those chronic diseases?
Well, we have a community health improvement plan group that is made up of our agencies and organizations within my county, and we came up with a plan to improve the health of our community because it really is a collaboration. It's not just a health department activity. And one of our top 3 priorities was obesity reduction because of its impact on the rates of diabetes and cardiovascular disease and hypertension. So those dollars help us be able to do the planning with the CHIP, with our Community Health Improvement Plan, as well as provide direct services related to chronic disease prevention. Because really the key here is preventing people. I mean, we've done a great job in this country educating people about smoking and not starting smoking, and once they start smoking, it's pretty challenging to be able to quit smoking. So if we can teach especially young people and young adults the importance of physical activity, eating right, and all those kinds of things in their early years, then it really has a positive impact on our monies as well as our health of our community.
Yeah, I agree with that, but isn't it a personal responsibility question? I mean, people know the right thing to do, don't they? To eat right, exercise, and don't smoke. And
well, I agree with you that I do think that it is a personal responsibility, but I don't necessarily agree with you that I think everybody knows the right thing to do. I think that it's important that people be given the tools and the positive environment and the support to be able to make those changes, because those behaviors that we get in our teenage years and in our young adult years pretty much stay with us long term if we don't really make a personal decision that we're going to change. I'll give you a personal example, and that's myself, because I decided that I needed to lose some weight a few years ago, and I've been in public health a long time, and I certainly know all that information. But it was because my blood pressure was going up and I didn't want to go on medication. Then I decided, okay, I better start watching what I'm eating. And but I still had to get support. I had to go to a clinic that helped me and provided encouraged me to write down everything, and also to engage in an exercise program. So I think everybody needs those kinds of supports. And remember that every dollar that we spend in public health or results in $7 in savings. Every dollar that we spend in prevention saves $7 in the long run for sick care, hospitalization, all those kinds of things. So it is a wise use of our tax dollars.
So is that the biggest challenge in your community right now, is the chronic disease issue? Are there other challenges that you're facing?
Yes, I would say that for my particular county, yes, the chronic disease challenge is the biggest. But there are other challenges as well, especially living in Florida. because of the number of disasters that we have in our that are natural as well as man-made. It's very important that we get those federal dollars that relates to preparedness. We've done a really great job in Florida, working with all of our community partners on preparedness, developing plans, exercising those plans, making sure that we're prepared for any type of a disaster. And those federal dollars really have made a tremendous difference for us to be able to do those kinds of things, because we don't have the dollars from the state or from the local level to be able to do that. So.
And I know that there have been some federal cuts in preparedness. Have you all experienced that as well?
Yes, we have. Those dollars come from CDC to the state and then go out to the local level, and we've had some staffing changes, and so we've regionalized some of those positions. We've had to work more collaboratively with our surrounding counties. Some of our planners now have 2 counties instead of 1. But all those things, we still know that it's very, very important that we do the preparedness planning, and that we do the exercises, and that we train our staff. So we're still moving in a positive direction, but I do want to reinforce that those dollars are very important to us.
Great. So one question that I have for you is, as all these programs are important, I don't think we would dispute that, but we also have a problem with the federal debt and the deficit. And so what would you suggest, what should Congress do to address the skyrocketing debt as well as these important programs that you're talking about?
I agree that Congress needs to address the deficit. I think it's very problematic, especially in the long term, that we do need to recognize that we can't continue to spend money, that we have to spend our money more wisely. So I would encourage Congress to look at those programs that are providing services that are evidence-based, that have a proven track record for working, those programs that don't have those kinds of things in place, that they make sure that there is a strong evaluation piece, and we eliminate those programs that aren't working, and we reinforce those programs that are working and making a difference. Because as I said earlier, every dollar you spend in prevention saves $7 in the long run. And I will tell you that on the local level, we really have to do that, because we have to stay within our budget. So as the budget cuts have come down, we've had to either maybe not do as many services directly, have to work more in a collaborative fashion. And actually, I think that's really a win-win. So we recently did a flu miss campaign in my county, and we had a private entity that came in and actually conducted the flu miss campaign in conjunction with our school system and with our health department. And from my perspective, it was a win-win-win, because we don't have the staffing to do that anymore. But we helped with the scheduling, we helped with the support, and it was a great public health initiative.
Great. Great. I'm glad to hear about that. So if there's one message you would carry or ask me to carry back to my boss, what would that be from today's meeting?
I would encourage your boss to go to his local health department the next time he's in his district, meet the health administrator or director and the other staff, and talk to them directly about what they're doing. Because I would venture to say that if she spoke to her board of county commissioners, that they will all know what their local health department is doing, and feel real good about what the health department is doing, whether it's doing disease surveillance and helping reduce outbreaks, or working in the schools, all of the other kinds of things that we do, environmental health inspections that we do on a daily basis. So I'd encourage Congresswoman to come and see your local health department.
Great. Well, our schedule is pretty full, but we will try to do that as soon as we can.
Great, thank you.
Thanks for your time today, and thanks for coming in.